Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. Exciting show just waiting for you. Let's get right to it. So a professor who managed to live underwater for a record 100 days claimed he has actually de-aged 20 years as a result of that experiment. And joining us to discuss is Professor Joseph Dituri, a.k.a. Dr. Deep Sea from the University of South Florida. Thank you for joining us.
How are you? Thank you for having me. I really appreciate it.
Now, you lived in a 100 square foot habitat about 30 feet below the ocean surface down in Key Largo for, what did they say, about 3 months? Can you kind of give us
100 days, yeah.
Can you tell us how the idea for this experiment came about?
Yeah. So it was December 24th of 2012. And I'm coming back from going over to James Cameron's house to work on his submersible that he took to the bottom of the Marianas Trench. When he went down there, he found a sea lice. Now, in Florida, the sea lice are kind of teeny and they just kind of bite you and they give you a little anaphylactic reaction. Well, one that he found at the bottom of the Marianas Trench was about this big, and that's about 11, 12 inches. Okay. So had them pull a DNA sample on it. When we pulled a DNA sample on it, it's a partial cure for Alzheimer's.
Oh,
wait, let me say that again a different way. A partial cure for Alzheimer's existed at the bottom of the Marianas Trench, and we knew nothing about it until he stumbled upon it. So I'm sitting in my office because the report is due to him on the 25th. Don't ask. I have no idea why it's due on Christmas. But I put my hands back in my head and I said, everything we need is on this planet. We have the yin, we have the yang, we have the dark, we have the light, we have the disease. We damn sure have the cure. We got to live in the ocean. And everybody's like, he's lost it. He's over the edge. So,
well, I remember reading years and years ago when, back in the 90s probably, where there was a lot of news headlines going around about slash and burn down in the Amazon to make way for cattle and all of this stuff. And, not only the natural beauty of the Amazon do we want to preserve, but they call it the lungs of the earth and all of this. But a lot of scientists said, a tiny, tiny fraction of the Amazon has actually been looked at. And there's probably a cure for just about everything that ails us down in the Amazon. We need to protect it. I'm sure you feel the same way about the ocean.
Yeah, the origin of species, if we all came from coelacanth, which is what we currently think, and it's morphed and mutated several different times, if one of it mutated to have a disease, it makes sense the other is mutated to have the cure. And we have found several cures in the ocean. Acyclovir, a powerful antiviral. It's found in sponges, which are only underwater. Fish have these capped ions. These invertebrates, aquatic invertebrates have these bixwanos that enable us to withstand chemotherapy. So there's a lot of tell that's out there that says that everything we need is here. We just got to look. And, Elon Musk is great. He's like, we're going to Mars. I'm like, Elon, I have a whole bunch of questions. We got lots of stuff to do here first.
Mm-hmm. And how did you really pass that time? I mean, were you lonely, bored, determined?
So I have a PhD in biomedical engineering. So I did anywhere between 6 to 8 hours worth of science a day. Blood, urine, saliva, electrocardiograms, electroencephalograms, pulmonary function tests. I'm doing all these tests on myself. If you've never done an electroencephalogram and set your brain up with those leads, you've never lived. But that was 8 hours of my life I could never get back each day. And then I did about 3 hours worth of outreach a day, give or take. I taught biomedical engineering at the University of South Florida. I taught that online. And I lectured to 5,579 students about science, technology, engineering, and math and said, listen, we have real problems. We need your help solving it.
We've been kind of following you because we're based in Tampa, and I understand you have great connections with Tampa. I believe your girls were raised here, even though you're on the other coast now. What caught my attention was you were talking about, I guess, these results. You ended the experiment, I believe, last summer, but I'm just seeing headlines about telomeres. We've talked about that because we've covered it on the show many, many times. Explain what they are and what you found in your own body.
So telomeres, these are basically on the end of the chromosome. When you do that DNA to mesh into RNA replication thing, when you reproduce your cell, on the end of the chromosome are these little ticks. And each time you you use one of these ticks to basically replicate your cell. And when those ticks are gone, those are telomeres. When those ticks are gone, that is cellular senescence. That is the end of life, right? Now, is this the cure for aging? Absolutely not. You get hit by a bus tomorrow. It's not going to do anything about your cholesterol. It's not going to do anything about all of those other comorbidities. However, if you strictly look at how many times you can replicate that cell leads directly to living longer, that is 100% correlation. Now, my telomeres are 17% longer than they were when I went underwater, which is pretty profound. I mean, I'm a 50, well, now I'm 56-year-old male. And when I went in the water, my extrinsic age was 44. That's because I spelled Jim with a G and not with a J, right? And I take care of myself and I eat correctly and I live a balanced life and I try and reduce the stress. That's part of it. But then 10 years, I was reduced to the age of 34 extrinsically, right? So that basically says, listen, you're at the point now where, you were not quite 20 years younger, but a good significant amount younger. And basically, all things being equal, I will live longer. But guys, this is a known mechanism of action of hyper, meaning more than, baric, meaning pressure, hyperbaric medicine. And we've been using hyperbaric medicine for almost 400 years.
How so?
So in 1640, the first guy said, hey, I wonder if this increase in pressure will help my digestive problems. He was a researcher, and he basically put himself in his own hyperbaric chamber and treated himself for pressure. The flu of 1918, treated in a hyperbaric chamber very successfully. Leprosy, treated successfully in a hyperbaric chamber. We're talking diseases of yore, right? Like way long ago. We don't have those things anymore, right? We don't have leprosy anymore. I mean, I know it happens, but Do
you think that the pressure on the planet was different, several thousand years ago, and that now, because it has changed, it affects us in a different way and creates illness and ages us? Yeah.
Yeah, no, I mean, I think stability in the pressure has been one of those things that we have. It's been since the beginning of recorded history, it's been about the same pressure. So, certainly for 400 or 500 years, it's been about the same pressure. So I don't think that that's an issue. I don't think that's what's accelerating it. As a matter of fact, as you see, people are living longer and longer, right? We are finding cures for diseases. We are out there living a better lifestyle. We have fresh water. We have good food. It's really not that hard. But now what we need to do is kind of sort of revert back to when we were trying harder to survive, and those sirtuin activating compounds that we could potentially extend life with those. It's really kind of a reverse thing now. I think it needs to be just a little harder. Let's agree that, look, man, the hardest thing that I have is that somebody didn't like my post or somebody, flips me off while I'm driving. That's not real stress. We used to get chased by saber-toothed tigers, right? Mm-hmm. And we'd have all these things that would activate that would make our lives last longer, right? Because we needed those things, but now we don't have that. So,
well, I guess it just goes to show, I think we all need to live underwater or in a hyperbaric oxygen tank or something like that.
We should just walk around with like space suits, pressurized, and talk to each other. Yeah.
I don't know, but it's amazing. So thank you for being on the program to share that with us.
You're very welcome. Thank you.
Professor Joseph Dituri, a.k.a. Dr. Deep Sea. Thank you for being on the program.
Thanks for having me, guys.
We'll have more after the break. You are watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that no more. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. Mark is a retired grandfather from Louisiana that loves staying on the move.
I have a small farm Basically, it's land. I don't have cattle. I run cattle with my nephew, but I have tractors, and I like to get out there and play on them and work around, just do in country stuff. I'm a country boy, have always been. I grew up around cows, farming, went to work in the chemical industry, and wound up being there for about 40 years. Had some physical issues that I had to retire. I'm in between states. I go from Louisiana to Texas because that's where my kids are, grandkids. I stay on the go. I'm a pretty active person. I don't like to let the grass grow under my feet.
That was until pain started making it difficult to stand or walk even short distances.
The way my pain started, it was over time. Before I even retired, I had got to noticing I couldn't walk as far. I would get fatigued. And I thought, it's just old age, and just tried exercising and keeping up, but it just got worse and worse. And here in the last 5 years, it just got to the point where I was going to be in a wheelchair if I didn't find something.
Realizing something was wrong, Mark went to see his family doctor for help.
And I had an MRI, and they told me I had spinal stenosis and that the vertebrae were rubbing each other. So what did I do? I went and bought a gravity table, thinking that if I lay upside down so many minutes, so many times a day, that everything would stretch out and it'd fill back in. But guess what? It didn't work. And I tried all kinds of pills. I would get shots, be good for about 3 months, and then everything would be right back where it started. And I went for therapy religiously. And then I tried also something called dry needling, which is a form of acupuncture. And none of it seemed to work. But it progressively had gotten worse and worse to the point where I was having trouble walking from one side of my house to the other without my back just killing me and having to sit down. So I was spending more time with my butt in the chair than anything else.
When conservative treatments failed to relieve his pain, Mark began contemplating what to do next. While speaking to his cardiologist, they warned him against traditional open back surgery.
Like I finally got to the point, it was either go to a wheelchair and become completely immobile, or else do something and at least try something where I could get around again. But my cardiologist, he just warned me, his saying was, back surgery begets back surgery.
Taking their advice to heart, Mark started researching his options, and that's when he heard about the Bonati Spine Procedures from a friend and former patient.
I found out about the Bonati Institute by word of mouth. The people that I talked to was a friend of mine in high school. His wife had it done, and she had had it done, and it's been quite a while. So I called and talked to her. She was 100% all for it because she was probably basically in about my shape. She said that after they talked to her, they told her to be careful because if she could break a bone, I'm in the same shape, and decided to choose this because the amount of downtime. This is a last hope for me.
Hearing what she had to say, he called the Bonati Spine Institute and spoke with a patient advocate. After sending his MRI in for a review, Dr. Bonati called him personally to tell Mark that he was a good candidate for the exclusive Bonati Spine Procedures.
He started telling me all my complications and problems. I didn't have to tell him. He already told me what was going on with me. That impressed me a lot. I mean, I was really impressed. It had an effect on me to where I automatically started getting the ball rolling to get this procedure done.
Patients are often surprised by the efficiency of the Bonati Spine Institute. This due in large part to the state-of-the-art on-campus imaging center.
I've been here 8 days. I think the state of Florida is going to send me paperwork to become a full resident if I stay here much longer. The process of getting me ready for surgery, it was almost like an emergency. I mean, go here, go there, just draw blood, just do this, let's get x-rays. And I mean, it was, now you see the doctor. And I have to say, y'all are very proficient.
Mark was happy to hear that he would be awake for his targeted Bonati Spine procedures, as conscious IV sedation drastically reduces the risks commonly associated with general anesthesia. In addition, this process keeps the patient alert and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
The sedation part of it was one of the things that attracted me to it. Watching the procedure, I liked it. I enjoyed being able to open my eyes, or if I close them if I wanted, but I could open my eyes and look, and I could see everything that was going on. Recovery was great, 30 minutes. They take several readings on your vitals, and if they look good, you're up, and they have you walk the length of the recovery room. And after that, you're getting dressed, and they're helping you out to your truck or car. I mean, the recovery is just almost instant.
While recovering from a Bonati spine procedure, surgical guests are not required to wear an uncomfortable brace or suffer through weeks of physical therapy. Instead, they are told to simply walk about 40 minutes a day.
I have friends that I've known that have got a scar from the top of their back, their neck, all the way down to the crack, and went through all kinds of excruciating pain. 30 minutes after the procedure, I was up and walking, and that was just a miracle in itself for me. I didn't want to be on my back for 6 to 7 weeks. Walking is the most important to them to keep the scar tissue broke up.
Mark highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I'm already recommending the Bonati Spine Institute. Several people I know that have back trouble, and I told them, I said, it doesn't cost you anything to go get that MRI and at least mail it to Dr. Bonati, because he will look at it and he will get back to you and he will talk to you. And that costs you absolutely nothing to do that. And I was impressed with that there was no fee to look and give his prognosis.
Mark is looking forward to playing with his grandkids, working on his land, and getting back on the dance floor.
I'm looking forward to being able to get out and walk again, because I've got my place, walk my fences, and stuff like that. My girlfriend likes to dance, and I used to love to dance, country and western dance. And so I want to take her dancing one night and just really show her a lot of fun.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store. Welcome back to American Medicine Today. So why don't you tell us, Dr. Bonati, what is spondyloarthritis?
Spondyloarthritis is an inflammatory process that affects the joints of the spine, primarily the sacroiliac joint and the facets. It's because in the past we called this problem ankylosing spondylitis. The ankylosing spondylitis is nothing more than a fusion that happened to the sacroiliac joint.
A natural fusion.
A natural fusion.
Okay.
But that fusion doesn't happen overnight. Take around 14 years of pain before that fusion will occur. And when that happens, then the pain disappears. So fusion in that area is probably a situation that should be studied. This terminology was used before because what really happens is the diagnosis of spondyloarthritis is very difficult.
All right. Why is that?
It's because 80% of the population has back pain. And the main problem to diagnose spondyloarthritis is only 1.4% of the people has the problem. And the symptom or main symptom of spondyloarthritis is back pain. So the problem that we have is how you diagnose that. Well, the diagnosis is more a type of a study of the gene that is responsible of this problem.
Okay, so it's hereditary then?
It's hereditary, yes. Usually it's familiar. So usually the family group has the problem and it's passed to the kids. And the gene is being called the LA27.
Okay.
Now, this is a BLA27, the one that creates the problem. And usually it's associated with a small trauma or any type of infection that happened on the spine. There are two different types of ways to diagnose this disease.
And what are those?
The first one is radiographic type. So what you do is you look at the X-ray and you look at the sacroiliac joint and you see some type of a small damage on the bone. It's like a moth-eating type of a injury that you see on the bone.
All right.
That is the type 1. And it's more frequent in men. You have a type 2, and the type 2 is more frequent in women. And the diagnosis is not really very clearly observed with X-rays. So you need to have an MRI. The problem is the symptoms are equal. Is back pain. Usually in the morning, when you get off the bed, you barely can move. Can be from slight type of a back pain to really a pain that you practically are immobile. And appears around when the people is around maybe 45 years old. The problem with that is confused. How you treat this. Usually the people go to the general medical physicians. The GPs are going to give you pain medication. They're going to give you some cortisone.
Okay.
And they're going to give you some anti-inflammatory, non-steroids, because this is something that is going to last for a long time. The pain usually lasts, when you have an acute attack, between 2 or 3 days to around 3 weeks. So it's really painful.
Okay.
But doesn't affect any other things. Doesn't affect the nerves. And the pain is back pain with hip pain and butt pain. So it's just all the back of the body structure is affected. And can be unilateral, can be bilateral.
Okay. Is this something where they would also try to send them to, a rheumatologist?
Well, usually when the GP gets this patient coming back and doesn't have any solution, if they think it's a rheumatological problem, they refer that to a rheumatologist or the neurologist.
Okay.
And then the patient ends in the hands of the neurosurgeons or orthopedic surgeons. But nothing can be done. 80% of the population who suffer doesn't have any relief. That thing comes and goes and comes and goes.
Right.
And not only affect the person, affect the family, affect the income, affect the relationships, and affect their job. Well, they need to be an answer. And at the Institute, we were working because we see people with this problem.
Correct.
And we're not doing any testing yet because I don't think it's necessary, it's expensive. And it's not going to tell me too much either. It's going to tell me, yes, this person is subjective to that type of inherited problem. And that's going to stop there. Well, that's going to cost a lot of money. And probably the insurance company, they are not going to do it. And probably the patient would not be very happy to pay a lot of money for something that they will tell them, yes, you do have a genetical problem, period. And you need to suffer the pain.
We'll be back after this quick break, continuing our discussion about spondyloarthritis. You're watching American Medicine Today.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
6 days after surgery, I was back in the gym. slowly but surely working my way back to fighting, back to basically 100% of fighting, you know. So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. I'm alongside Dr. Bonati, and we're continuing the discussion about spondyloarthritis. Is this something that can be treated with the Bonati Spine Procedures?
That is what I have few cases of this problem at the clinic. And we thought that there one area that the responsible pain is the dura. So we isolate that area and put some type of a soft support that area, not the bony structure or the ligament structure that is harder. And then we separate the dura for that contact. And to our surprise, the patients react very well. So it's a surgical procedure, and it's a procedure that is successful. But because the population that we deal with is only 1.4, but 80% of the population has back pain, then it seems to be that this procedure will be able to control also the back pain. And if we can control the back pain, then the classical symptomatology of the spondyloarthritic problem will be solved.
Correct.
With the technique that we have, we correct the problem immediately, and the patients are satisfied with it.
All right. Well, to see if you're a candidate for the Bonati Spine Procedures, visit askbonati.com. And you can add us to your streaming channel lineup, search Bonati or American Medicine Today. Thanks for watching. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.